a problem with the hormone that handles sugar in the system. So insulin, that hormone is called insulin. So either the insulin that is produced is little, or it's produced and it's not functioning the way it should function. And what does this lead to? This leads to increased blood sugar level. That is really what diabetes is about. Some of the signs and symptoms include somebody who urinates a lot. So we call it polyuria, excessive urination. Then also someone who drinks a lot of water. So if you observe these signs in yourself, drinking a lot of water, then eating a lot of food as well. And this thing goes with, even though they are eating a lot of food, they are also losing weight. So increased eating and then loss of weight as well. They also have frequent infections like frequent boils, frequent urinary tract infections. For women, they have what they call frequent whites. White is discharge from their vaginal area. So they complain of these discharge, very frequent of them. Now, the other thing that diabetes, all the symptoms who can come in advanced stages, like somebody comes in with blurred vision, eyesight being blurred, or having a problem with their kidneys, so they can show with kidney symptoms, scanty urine and things. So those are like, they present with a complication. Some can come having had a stroke, or even having had a heart attack. Some can present like that. That is, it's gone on for a while and they come in with the complications. When you come in for the first time, we'll take a history from you. We would examine you thoroughly, and then we'll request a lab test. Some of the lab tests we'll request include a fasting blood sugar. We'll request your glycated hemoglobin. We'll request other labs, cholesterol and other things, because diabetes goes hand in hand with other conditions like hypertension and high cholesterol. So we'll do a thorough investigation and then we'll come to a conclusion. When we conclude on it, the treatment, how we'll treat you, will depend on all these lab tests that we have. So we don't have one mode of treatment that this is what we use. No, sometimes we give you tablets, sometimes we give you injections, sometimes we give you other things. But one of the greatest things that we do in diabetes management is lifestyle modification. Lifestyle modification. Lifestyle is something you do every day. What do you do every day with your, what do you eat every day? How do you manage yourself every day? These are the lifestyle things that we give you. And we usually say that the drugs without these modifications is not going to work well. You need to definitely do these modifications in your life. What are these modifications? If you smoke, we will tell you to stop smoking. So we have what we call zero smoking. No smoking. So 0 is for no smoking. Then we have from 0 move to 5. 5 is taking at least 5 helpings of fruits and vegetables on a daily basis. You need to do that. And 10 is having at least 10 minutes of relaxation daily in your life. Every day, make sure that at least for 10 minutes you are resting and relaxing. Then 30 is your BMI, or we call your body mass index. When we take your weight over your height, your weight in kilograms over your height in meters squared, it shouldn't be more than 30. Then you know that you are living a lifestyle that will not tip you into getting some of these conditions. Now, 150 exercise is very important in diabetes management. And with the exercise, we say our recommendation is at least 30 minutes of brisk walking, 30 minutes of moderate exercise at least 5 days in a week, and that comes to 150 minutes of exercise in a week. These are the things that we are going to talk to you to modify your lifestyle to prevent disease conditions like diabetes. So there are two main types of diabetes. There's type 1 and then type 2. What we call the juvenile onset and then the adult onset diabetes. So some are diagnosed when people are young and others when they are older. So basically those are the two main, and both of them have different modes of treatment. That's what makes them different. For the younger ones, they will need insulin to be replaced. So most of them, we give them insulin directly because they are not producing enough. But for the older ones, they are producing the insulin, but they are resistant, and they are functioning in ways they shouldn't be functioning. So some of them can work if you give them tablets, or sometimes you may have to add insulin injection to it. Basically, these are the two. The problem with the issue with the juvenile or the type 1 types is because they are young, they don't have much understanding about these conditions, so it's difficult to manage them and make them understand that this is something that you're going to live with and you must take your injection. So most of them end up defaulting. The issue about stigma when they go to school is also there. How are you going to get out of lectures, go and give this injection? Everybody's come to school, you're a young person, you are going to be giving yourself injections. So they need a lot of psychotherapy. They need a lot of psychotherapy. And these days there's also youth groups, like there's a youth organization called Diabetic Youth Association, where such people belong to, and then they are able to cope better with the disease condition, because you see other people your age functioning very well in whatever they are doing and doing well. I had a patient once who was depressed, and I sent her to this diabetic youth group, and ever since, anytime I see her, her joy is back. She's very happy, she's ready to live on, and she doesn't want to end it anymore. Diabetes, as we know it, there's no cure. We say we are curing it. No, there's no cure per se, but it is controlled. It can really be controlled to the barest minimum for you to live a very normal, happy and regular lives. And there have been times when people have actually had reversal, people have actually had to be stopped, and medication stopped with several medications, and then also lifestyle management, strict lifestyle management. They've had their medication stopped. Pregnant women are not exempted from diabetes. They also get diabetes in pregnancy, and they are managed usually at the maternity unit, mostly with insulin. That is what some of them diet and then insulin therapy they are managed with. And for them, usually the advice we give is after delivery. Some of them may go back to their normal state, others too may have the diabetes persistent. So even after delivery, they will need to continue to check and make sure that they are really clear of it. Risk factors for you to get diabetes include having a family history. So once you know that your family history, there's a family history of diabetes, you need to be on the lookout. And then also smoking, alcohol intake can all increase your risk. Obesity, BMI greater than 30, you're overweight, obese, can all increase your risk of getting diabetes. Sedentary life, when we say sedentary life, you sit at one place all the time, no movement, no action, no activity, can all increase your risk of getting diabetes. Having hypertension is also a risk. We call them, they are like twins. They sort of sometimes move together. So having hypertension can also predispose you to getting diabetes.